Greetings, greetings. Today we're going to talk about hip pain from arthritis. Now, Sam is going to help us out here, but if you have hip pain from arthritis, you've been to the doctor, your x-rays show the joint's looking a little rough, and we're looking at the joint right here, the ball. There's actually a decrease in space. The doctor will show you that. They'll say, that's not good. Look at the good side, look at the bad side. We're going to show you some exercises that you can do to improve the pain, get you walking better, and then sometimes even avoid the surgery. If you have a stairway like this, and most people have one available at home, what you do is if this is the hip, I got the weight down here, is the one that's painful with the arthritis, that one is going to be dangling like this, like a pendulum. Okay, you can do this with a weight around your ankle to get a little more traction on the joint up here, but you don't have to. You can do it without that. I have it there just to show you, plus you can designate it. Okay, so the key is that you learn to relax the muscles around the hips so that the joint can distract, open up that space, get the fluid, the synovial fluid in where it belongs.
You're getting motion without pain.
Yep. And that takes a bit because it's a painful hip. The natural tendency is to contract, and you don't have to. You're not even thinking about it. So sometimes you can just massage these muscles, really relax, breathe. You're not going to have the TV on. You're not going to be talking to someone. You need to do this quietly, breathe, relax, and then you're going to feel things loosen up. I've had good success with this. Bob has painful hip. The pink represents the hip or the side with the pain. And he just lifts and puts his ankle above the kneecap if you have the range of motion, and then allow gravity to let that knee go down. Now, if these create sharp pain, it's too aggressive. It's not for you. Things are too far gone. But you should be able to do it, hopefully, and just gently allow it to relax. You're going to hang out like this for, a couple minutes, up to 3 minutes at the most. Okay, the third option. Now, this option, it does take a second person. As a matter of fact, that same patient I had, I taught her husband to do this, and it's very easy to do. You just have to be careful. So here's a painful leg. I'm going to grab the leg. It'll be done on the bed, of course. They actually bought a plinth for their house because,
Oh, really?
Yeah, because they use it a lot. So you gently grab the ankle here. And what I'm going to do is just gently pull out. And it's not you're not pulling as hard as you can.
And no pain.
Yeah, and so the person pulling must listen to the other person. If they say, yes, pull more, pull more. If they say, oh, it hurts, you respect that and back off and maybe even stop.